Hello viewers, welcome to the Editorial Analysis by Dristhi IAS. In this section, we regularly take editorials from various newspapers and news portals for a better understanding of various issues happening in India and around the globe. Dear viewers, in this section, we first try to link the editorial with our UPSC syllabus. Then we go analytical in order to understand some key points and at last some important concepts. Dear viewers, we truly hope that you like this initiative taken by Drishti IAS and your feedbacks are important for us. So kindly feel free to give your important feedbacks in the comment section. So without any further delay, let's commence our session.
Dear viewer, this video is available in Hindi as well. If you wish to watch it, please visit our Hindi YouTube channel, Drishti IAS. For your convenience, the link for this video in Hindi has been provided in the description below.
Today's editorial is taken from the Financial Express published on 15th of December 2020. The title of today's editorial is Fight Against Child Malnutrition. If we try to link today's editorial with our UPSC syllabus, we can link it with GS Paper 2 and primarily with the sections that include poverty and issues related to malnutrition and hunger. Some key points from today's editorial. The latest child malnutrition numbers as reported by the first phase of the National Family Health Survey 2019-2020 should prove distressing for the policy. A report based on the NFHS data says that several states have reversed course on key malnutrition indicators and have recorded worrying levels over NFHS 2015-2016. See, recently the data by NFHS was released and it said that several states have actually reversed their course on several key malnutrition indicators, and they are quite less as compared to that of the data which was given by the NFHF in 2015-2016. And this is despite the gains the country has made on access to sanitation and clean drinking water, a factor that is closely tied to child malnutrition. One of the most surprising factors for such a data is that despite the country has gained access to clean drinking water and better sanitation facilities which are quite related to child malnutrition, even though the states have not been able to perform well here. Now, if we speak about National Family Health Survey, it says that first of all, what exactly the NFHS is? It is a large-scale multi-round survey conducted in a representative sample of households throughout India. All the NFHS have been conducted under the stewardship of the Ministry of Health and Family Welfare, with the International Institute for Population Sciences, which serves as a nodal agency based in Mumbai. Now, this was the first phase that came up with its data. The phase 2 of the survey was delayed due to the COVID-19 pandemic and its results are expected to be made available in May 2021. Now, if we speak about the survey, so the NFHS 5 captured data during 2014 to 2019 and its content is similar to NFHS 4, which was during the duration of 2015 to 2016. To allow comparisons over time and also mark shift from it. It provides an indicator for tracking 30 sustainable development goals that the country aims to achieve by 2030. However, NFHS 5 includes some new topics such as preschool education, disability, access to a toilet, facility, death registration, bathing practices during menstruation, and methods and reason for abortion. In 2019, for the first time, the NFHS 5 sought detail on the percentage of women and men who have ever used the internet. However, if we speak about the analysis of the data, it says several states across the country have reversed course and recorded worsening level of child malnutrition despite improvement in sanitation and better access to fuel and drinking water. Like I said, the latest data captures the state of public health in the states before the pandemic. Several states have either witnessed mere improvement or sustained reversals on 4 key metrics. Now, those 4 key metrics are: number 1, child stunting; number 2, child wasting; number 3, share of children underweight; and number 4, child mortality rate. Okay, now the data from these metrics is also used in several global indices such as the Global Hunger Index. So this was something with reference to that of the NFHS survey, which came up with its first phase. The second phase results are about to come in the coming year, May 2021. As per the first phase of the NFHS 2019-2020, which covers 17 states and 5 union territories, including Jammu Kashmir, several states like Telangana, Kerala, Bihar and Assam, as well as the Union Territory of J&K, saw an increase in the number of child wasting. See, state of Jammu and Kashmir, it actually observed an increase in child wasting. That means various parameters such as child stunting, etc. They were quite prevalent in the state of, at that point of time, it was the state, now it is Union Territory of Jammu and Kashmir. This reflects acute or short period malnutrition with afflicted children having low weight for their height. So what exactly child wasting is? The idea of child wasting is when you compare a child, there is a particular height and a weight which is mandatory for that particular height. So we have observed several cases where what the height of the children is, their weight is not in comparison that what it should be for that particular height. Child wasting in India has always been at higher level as compared to that of other economies. Now, if we speak about India's status and many other, so what we can say here is that India, according to a nutrition report that was global, it said that India has 1/3 of the world's stunted children. 1/3. See, we know that India is facing a major malnutrition crisis, and because of that malnutrition crisis, almost 1/3 of the world's burden for stunting is right now in India. Overall, if we speak about the world data, there are almost 46.6 million children who are stunted in the world, and India tops the list of this country, followed by Nigeria with 13.9 million, Pakistan 10.7 million. Okay, this was according to the Global Nutrition Report of 2018. The proportion of underweight children in several big states such as Gujarat, Maharashtra, West Bengal, Telangana, Assam and Kerala has also risen. Underweight, the issue of the underweight children, it has also increased in various states like Gujarat, Maharashtra, West Bengal, etc. Now, child stunting, low height for age, is a sign of chronic undernutrition. See, undernutrition, the child is not getting the required nutrition for a very long time, and it has increased in states like Telangana, Gujarat, Kerala, Maharashtra, West Bengal. Stunting is of particular concern since it is an early indicator of undernutrition's lasting, often lifelong, imprint on the development of a person, including the cognitive development. If we speak with respect to stunting, one of the most important concerns associated with stunting is that the effects of stunting might remain for lifelong, and also it might also affect the mental and complete physical development of a person. Given this data is from the survey before COVID struck, and that data for key states such as MP and UP are still to come, chances are the overall picture will be darker. See, this data has only come from 17 states and 5 union territories. Data is still yet to come from states like UP and MP. So definitely we can say that once their data is also with us, the picture will be even darker. Okay. Civil disruptions in terms of impact of shutdowns, restriction and lost income are likely to have affected the nutritional security of households quite adversely, more so in the poorer states. And like we know that during the lockdown, many people lost their jobs, the incomes were reduced, and there were several other impacts of the shutdown. And those things, why definitely they will appear with reference to this data, because many families must have lost the nutritional security. And especially this data, when I'm speaking about losing nutritional security, this is quite obvious with respect to that of the poor states. The present scenario, the fact that the infant and the under 5 mortality rates appear to have stagnated. Under 5 mortality rates have fallen in low single digits or remain the same in key states, while the NFHS 2015-2016 has reported a sharp 33% decline over the NFHS 2005-2006, is indicative of child malnutrition being central to mortality. However, there are several good aspects as well. Like if we speak about the mortality rate of the children below 5 years, we have a data. Okay, now according to a study, the under 5 mortality rate, that is U5MR, the under 5 mortality rate in India has decreased from 83.1 deaths in 2000 to 42.4 deaths per 1000 live births in 2017. So this is something which we can be definitely proud of, but yet there is a lot of work to be done, and this figure has to be brought down to 0. Okay. Also, the previous two NFHS bracket a high growth period given the effect of wealth on nutrition level as discussed in a recently released study by Shahana Josh, Ashok Gulati, Kriti Khurana. It is clear to fix nutrition, especially against the background of the pandemic, the country will need to focus on meaningful economic revival. See, we have to see this thing as well. We have to bring this thing into consideration that according to the last two NFHS surveys, there was a period where the growth was quite good, quite okay. And definitely it had impacts on the increasing nutritional level. And the same has been discussed in a study that was provided by Shahana Josh, Ashok Gulati and Kriti Khurana. Now, according to their study, they have said that one of the most important things associated with malnutrition is women education. India needs to ensure mothers' higher education in order to eradicate child malnutrition problem. So, one side, government has to pay attention on women education and several other aspects. On the other hand, once this entire pandemic situation is over, government has to focus upon the revival of the economy. The Josh Gulati Khurana studies also underscore the importance of multidimensional approach to tackling nutritional challenges with factors such as mother education, age of childbearing, etc., having a significant bearing on the child's nutrition security. Like I said, the study given by these three was very important, and it focused upon taking several initiatives towards mother education, because mother's education, especially higher education, can directly tackle the issue of nutrition challenge. Okay. Also, given the micronutrient deficiency, micronutrient deficiency. When I'm speaking about the macronutrients and the micronutrients, we should have an idea about that. First of all, nutrients have been divided into two categories. One is the macro one and the other one is the micro one. So there are 7 major classes of nutrients, that is carbohydrates, fats, dietary fibers, minerals, proteins, vitamins and water. If we speak about micronutrients, so micronutrients, they have been classified into 4 different categories. Number 1, the water soluble vitamins, fat soluble vitamins, microminerals and trace minerals. So given the micronutrient deficiency exacts a heavy toll on child development. One of the most important reasons why there is such an issue with reference to child development in India is because of the micronutrient deficiency. The comprehensive National Nutrition Survey, reports concerning levels of deficiency of iron and certain vitamins among school and school-going age children, leading to anemia, low bone density, reduced immunity, etc. See, there was a survey, which was the Comprehensive National Nutrition Survey. Now, it was the first ever National Nutrition Survey, which was conducted by Center, and it was conducted among almost 10% of children in the age group between 5 to 9 years and adolescent in the age group of 10 to 19 years, and they were actually said that they are pre-diabetic, and 5% out of these, they are overweight. This Comprehensive National Nutrition Survey, it was conducted by the Ministry of Health and UNICEF between February 2016 and October 2018. So also according to this survey, it came up with the report that there is a severe deficiency of iron and several vitamins among school going children, and it actually leads to some of the issues like anemia, low bone density, less immunity, etc. So there is a need to mount efforts on biofortification of crops, especially those procured for the PDS. Bear in mind, Save the Children pegs the economic cost of micronutrient deficiency at 15 to 46 billion USD. The future ahead, the government needs to set up efforts under its flagship nutritional security program, the Poshan Abhiyan. Okay, very important for us to see what exactly the Poshan Abhiyan is. This Poshan Abhiyan was actually launched by the Ministry of Women and Child Development, and it was launched by the government on March 8, 2018. This Abhiyan targets to reduce stunting, undernutrition, anemia, reduce low birth weight by 2% per annum respectively. The target of the mission is to bring down stunting among children in the age group from 0 to 6 years from 38.4% to 25% by 2022. The Poshan Abhiyan also aims to ensure service delivery and interventions by the use of technology, behavioral change through convergence, and lays down specific targets to be achieved across different monitoring parameters. So, the Poshan Abhiyan under the Integrated Child Development Services (ICDS) umbrella. Targeted interventions under Poshan Abhiyan have seen only around 50% coverage. See, even the impact of the Poshan Abhiyan is limited only at 50%. That means it has been used only to 50% of its efficiency, and it has not been able to target the complete entire area, the complete sphere that is required to be targeted. Without more intensive, widespread and multi-pronged efforts, the concern is the post-COVID era could look worse for India's nutritional security for children. See, unless more intensive and more tedious efforts are not put, the situation of nutritional security for children in India can definitely go very worse. So, viewers, we have to take such initiative. The government has to come up with several programs where this issue of malnutrition is being addressed properly and the required initiatives are taken in a right manner. So viewers, this was with today's editorial analysis. I hope you liked it. Now the question that can be framed with reference to today's editorial is: critically examine whether growing population is the cause of poverty or poverty is the main cause of population increase in India. Another question that can be framed is: what are the main causes of poverty in India? Discuss. So viewers, this was with today's editorial analysis. I hope you liked it. Thank you very much.